and continue the morning block here. We have another special guest, Anne-Marie Montero. Again, as I told you, I cultivated these speakers from our diverse expertise, and I think Dr. Montero is no different. She's a medical psychologist with extensive experience in oncology, rehab, women's health, and chronic medical conditions. She really brings the whole package. She's been active in research and really focuses on the impact of GI conditions on a variety of psychosocial issues. There's really not a better person to give this talk on caregivers than she. So, Dr. Montero, thank you so much.
Thank you so much, Dr. Lambert. Hopefully everybody can hear me, but I want this to be more casual and comfortable. First of all, I want to thank Dr. Lambert for having me and for organizing this conference. I think he deserves a round of applause for sure, right? Is it fantastic? Absolutely. Fantastic opportunity for people to get together and in a very unique forum, and I hope this is the beginning of lots of great opportunities like this for everybody to get together. So I know we are here on a Sunday morning. Everybody's been sitting for a while, so I want to make sure to have this feel refreshing to you. So I'd like to have this be a little more interactive. I'd like to start with some of the, just a basic overview of a little bit of information from our literature, kind of what gives us the information to know how we approach topics like this when we're working, when we have the honor to work with people like you. But I want to make sure we leave room for talking together about the things that are most relevant to you guys this morning, because that's what we're here for. So hopefully I know how to move this correctly. Okay. My paperwork over here. Also, before we get started, I want to add, I have a particular passion for caregiving for two reasons. One, I think it is of critical importance for anybody going through anything challenging or emotionally impactful in any way in their life. The people who come alongside of you, of course, it's what makes life meaningful, right? So I hope many of you are here with people who are caregivers, and so I'd like to add we're all caregivers in some way, right? Caregivers of ourselves, of people we care about. And also it's a lot of what motivated people like me and Dr. Lambert and your other presenters here today to be in our professions, right? We care about people, we want to be in helping roles, and so it's certainly important for me as a professional and as a human being to talk about this. I used to work with the transplant division for 7 years at University Hospital, and I started the transplant support group, which was primarily comprised of our liver patients, in part because I wanted people like you to have the opportunity to connect with one another. As well-intentioned as we are as providers, I felt it was essential that you all have the opportunity not just to hear from us, but to hear from each other about how you're coping and what was working well for you. So that's why I started that, and something I hope we can continue in that spirit here today. Okay, quickly, because I know we have time limitations, I want to be respectful of Dr. Lambert's schedule today. Caregiving roles have been given a lot of attention in the media. In fact, they've kind of designated this sort of a syndrome, which I think is a little bit funny. Just some basic background to this. I hadn't realized quite the dimensions, but in the United States, they estimate 29% of the adult population is already in caregiving roles, which of course stands to increase because we all know of the aging population trends with the census. And sometimes this is because of illness, sometimes this is because of age, often because of both. And again, if it's only likely to grow, it's going to be a bigger phenomenon. I want to emphasize that there are sort of two sides to thinking about caregiver roles, depending on your perception of them. The media is focused a lot on the risk of caregiver roles. For example, risk of depression, personal taxation when you're in the position of caring for someone else. In fact, that's why they've kind of identified this as a syndrome. But I think it's very important to conceptualize of this as something that has to do with how we're perceiving what we're doing. And so, it can bring with it some challenges, but also, depending on how you're perceiving it, a lot of benefits as well. And I've got some data to kind of give you some dimensions on both sides to that. So, CNN, for example, recently did a story on highlighting attention to the risks of being caregivers, like increased incidence of mood issues. That's just a fancy way of describing depression, typically. Increased underlying levels of anger, worry, or anxiety, Some cognitive changes like memory issues. I think that's largely because people have so much on their plates. When you're under increased stress or you're experiencing increased anxiety, people tend to have some cognitive changes like that. They're usually very short term. Some changes in people's health and physical well-being, and also very importantly, health behaviors. That's like how you're taking care of yourself or someone else, how often you're exercising, how well you're sleeping, how often you're going to the doctor and eating well, as some of our presenters have been talking about today. So these are factors that are likely to change when we're being caregivers. Why is this? Largely because our time priorities have changed. Often when we're taking care of other people or contributing to their care, we're focusing a little bit less on ourselves. That's not the entire reason, but that's a contributor. Most people who are caregivers are experiencing several types of challenges. Mostly people continue to work. 59% are already working when they take on the roles of caregivers. They're usually unpaid. And the statistics I found, I thought were kind of surprising. A significant proportion were already older and then would find themselves in the role of caregiver. So often this would probably be spouses, right, for someone who develops chronic illness or acute illness. And this can promote increased pressure on families, financial, logistical, and practical. So again, people already needing to take care of their own health and well-being, and then increased frequency of doctor visits, for example, comes up. And that can be a major challenge, especially when people are already experiencing needs of their own. So I want to sort of separate how we're thinking about this into two camps. One is practical or logistical challenges, and one is emotional. Typically, they'll overlap, and one can help feed the other, right? If you're already overwhelmed in terms of your time, then adding on, for example, again, needing to get to the doctor a lot more frequently can certainly add to anxiety, and vice versa. If you've got some emotional challenges going on, or you're very worried about your loved one, and then suddenly you're much busier, you have increased financial pressure, that can absolutely add to your challenges with emotional coping. When people are facing challenges, how they bear up under stress can come out in different ways. The literature highlights some statistics that I don't want to suggest are necessarily occurring for you all, but they indicate in general that caregivers can at times have some health behaviors that aren't as adaptive. For example, taking less care of their own bodies, like I mentioned before, less sleep and less exercise. Your own needs can tend to fall away when you're trying to prioritize something that someone else needs, and especially if it feels acute. If there's a sudden new need, that feels like the most urgent and critical thing at the moment. So our own needs will tend to take a back seat. Chemical coping can increase. By that we refer typically to use of alcohol or recreational drugs. Prescription medications, of course, can fall into that category if they're not used appropriately. Other aspects of self-care. For the sake of time, let me just leave it at that. But I want to add critically here, this again very much depends on the perception of the caregiver. Caregiving can be a blessing as well as an increased challenge. So I want to move on and focus on that, but last point on this before I do in terms of the challenges. There is an interaction with someone's sort of baseline or underneath mental health and well-being. So if someone is having pre-existing symptoms in some form, like for example anxiety, taking on the role of a caregiver can add increased stress and challenge, of course, and that can lead them to be predisposed to increased challenges with coping. And vice versa, if they're doing well prior to taking on the role of caregiver, the likelihood is, I explain this to my own patients in terms of like a synergy often, that small gains will lead to major increases down the road, sort of a snowball effect. So for example, if somebody's already, for example, generally doing well in their own life, then they take on a new challenge and they do well, they're likely to feel some increased well-being, sense of efficacy, like I can do this, this is something I can accomplish. Then they're going to feel an enhanced sense of control. We call this locus of control, like feeling like you can manage the world as opposed to something happening to you. And then you're likely to feel like you can take on more. And as you do, this sort of becomes, you can see sort of a positive cycle spinning up here, right? Like people feel good, they can take on things and they feel efficacious about it. There can be a similar cycle in a negative context if people aren't feeling well or take on things that can be straining or challenging. And that can lead people to feel at times overwhelmed. They can have sort of, at times, what we call an external locus of control, like you might feel like things are happening to you as opposed to you driving the bus. And then with those feelings, people can be more prone to anxiety or depression, which can lead them certainly to feel like they're less capable of handling things. And that can lead to sort of that downward spiral of well-being. So I talk about that a lot in treatment with my patients. That's really important to recognize sometimes some very small wedges in that process can make a big difference. If you start to increase just a little bit your well-being or your sense of efficacy, like I can do this, that can make a very big difference down the road in that cascade of changes. Did somebody have a question? Oh, that's okay. We'll collect them. Okay, great. Feel free to interrupt me, though, as well. Just raise your hand. Okay. So in terms of coping with those challenges, the literature suggests that people who fare best have a couple of factors going for them. The first, I found this to be super interesting, acceptance of mixed feelings, meaning you acknowledge this is going to be a mixed bag, right? There's likely to be a lot of scary stuff happening. There's likely to be a lot of good things occurring. You can at least look at it that way, like at least we don't have worse stuff going on, right? Lots of different ways to kind of shift our thinking around that. But acknowledging that there are going to be some hard things occurring as well. And when you go in expecting that that's going to be the case, it makes sense that those people are going to have the best adjustment. Increased support is critical, and I want to talk a lot about that at the end here. Reaching out for support in your own life as you're a caregiver is really crucial to maintaining your own sense of well-being and continuing to be there for the person that you're trying to provide for. I used to talk in my support group a lot about the analogy on the airplane that you're supposed to put on your own oxygen mask before you attend to the person next to you. And often when we're caregivers, I think we think of immediately attending to that other need. But if we don't have our own oxygen supply, we're not going to be in a position to provide for them for very long, right? Because in the plane you'd be passing out. So by analogy, you want to think about continuing to provide for your own needs in a long-term, reasonable way while you're also working to help support that person that you love. And I think that's just can't be emphasized enough. I mentioned before in that idea of the cycle, the idea of those small wedges making a big difference down the line, an increased sense of control, and I put here awareness. By that I mean like educating yourself about what's coming, going to the doctor's appointments with your partner or your family member, looking online, although I'd be very careful about that. I have a lot of patients that I just prohibit going online because they can get overwhelmed, right? You start researching things and you read all the scary stuff and then that looms large and you don't have a way to kind of either filter it, appropriately contextualize it, or counterbalance it with appropriate information that's accurate but also very relevant to you. I think that's the main thing about the internet. Is it relevant and is it contextualized? So I'd just be careful when it's good to gain awareness and information, but within a good context, right? The literature supports seeking help, being proactive about that. Of course, I would suggest considering professional support. I know there might be some stigma about reaching out for that, but I consider it a very smart and proactive thing when I have patients who are willing to come for seeking, whether it's another opinion or seeking longer-term help like counseling. And I put on here being active, critically, again, taking care of your own health needs as well as those of the person you're trying to care for, I think is super important. Now, there's another side to this coin. So I've been talking about the risks so far here. There's also an enormous amount in the literature around reward. Now, this is not directly connected in the literature to caregiving as much as it is to other concepts, but I think they're very directly related. For example, connecting this to altruism, the idea of doing something for someone else, or love. There's a lot of science behind physiological and emotional benefits of love. So we feel greater connection with the people that we care about. We can feel needed, which tends to do wonders for your own self-image and self-esteem. There's literature to support increased patience. I bet people could attest to that very directly in here. It takes a lot of patience just to have a chronic illness at all. Sitting in the physician's waiting rooms or the psychologist's waiting rooms can be one area where I'm certain everyone's learned to practice that. and often there's an enhanced sense of emotional reward. And I found literature around that fascinating. I'll get to that in just a second. This concept of giving for others, of course, is long known to mankind, and in fact, certain people appear oriented to giving to others, which, again, I mentioned I related to the concept of altruism. I like this definition of it: the act of giving of oneself out of a genuine concern for other people and the unselfish concern for the welfare of others. So it's known universally across cultures. It tends to manifest early in life, people who are oriented to giving. And it activates a certain brain response. It's really just our science catching up to what the body's already, in a very sophisticated way, doing. But we're now able to identify what some of those changes are. Of course, giving can be a learned behavior, but there's interesting evidence to suggest this is sort of related to character traits, meaning this is part of who you are as a human being. You kind of came this way. So most of the people who are giving have some dimension of that, and then they've learned along the way components of how to give well. But people who get the best benefit out of it, they're linking some dimensions to stable character traits, which just, again, means there's a sense of permanence. This is part of who you are. So just quickly, some very fascinating studies around health benefits for giving. A Vanderbilt study looked at more than 3,000 volunteers and found statistically significant differences across several dimensions, including happiness, improved physical health, and longer life. So they died a third less often, or a third less early. So people actually lived longer by virtue of giving. Digest that for a moment. The very act of giving of yourself helps enhance your own life and well-being. In New York, there was a study of regular volunteers, and they looked at specific physical symptoms. Get a load of this. People had not only things that you might expect, like general, and I'll get to immune system stuff in a minute, but general symptoms like headache, even pain remitted. I think people had less perception of it probably, but even something as specific as loss of voice was reduced when people engaged in caretaking behaviors. And certainly mental health improved as evidenced by lessened rates of depression. There are health protective benefits in terms of, and Dr. Mackay talked about this a good bit, improved immune functioning. I think this is fascinating. So people who were engaged in volunteerism or giving experience several different manifestations of this. Reduced stress response, he talked about the parasympathetic and sympathetic nervous system responses. Your stress response is that, you remember from high school science, the fight or flight response in your body, that feeling. People who give have less of that. Improved health protection and relaxation. That's the activation of the counterbalancing trend in our body, which is the parasympathetic nervous system, the calming impact. So it enhanced the body's ability to sort of calm itself and stimulated the production of feel-good chemicals that are endorphins, like enhancing pain control and even producing something called the helper's high. You guys have probably heard about the runner's high, like people who engage in regular sustained cardiovascular exercise that get this kind of like high good feeling. This is the brain's way of kind of giving you a reward for doing good things, and helping other people gives us that feeling as well. I see several smiles in the audience, so I'm guessing some of you know what that feels like. It feels really good to give to other people. And interestingly, some of the literature supported that it will be even more beneficial when you don't know the people you're giving to. I would kind of anecdotally challenge that. I think when you know people and can see the benefit of what you're doing, there's a significant reward there. And in fact, actually, other studies do counterbalance that. They suggest that we can maximize this effect when we're giving to people in a one-on-one situation. Usually that implies you know the person that you're giving to. When you are feeling appreciated, so what you are doing is acknowledged, and when it's reciprocated. So somebody is knowing you, giving, appreciating, acknowledging what you're doing, and giving back to you. That's sort of like the ideal setting in which caregiving can occur. And when that happens, we have some phenomenal statistics around how good you can feel from this. A whopping 95% of people felt really good when they were engaged in the act of giving. Almost 80% of them, that feeling lasted for a long time after they engaged in giving. And then amazingly, people, almost the same amount, or even more actually, felt good even when they were thinking about what they had done before. So when you are engaged in loving acts toward other people, you're doing yourself an enormous favor. And it has a cascade of physical benefits. Dr. Mackay discussed some of this in terms of activation of T cells, reduction of stress hormones, aiding lymphocyte function. So all of those are just some specific manifestations of why our body is doing well, but our bodies like it, our hearts like it, and our souls seem to be doing better when we engage in this kind of behavior as well, which is within our control to do. We can choose to activate this in our lives. So I would, of course, for self-protection, encourage you all to be aware of your own needs. When you're engaged in caregiving, pay attention to warning signs like feeling overwhelmed, having sleep disturbance. I know when, for example, last night, well, I have a small baby, but when you're up overnight, as I was last night, I know generally that means there's some emotional turbulence going on. It's time for me to talk to somebody. That, anxiety might be creeping up. You might be worried about that person that you're caring about. You may have some underlying sadness that you need to address, or other complicated feelings. It's very common to feel different experiences like guilt or anger. It's hard to express that to the people you care about. Often we have sort of a self-protective or other protective filter. We don't want to worry them more than they're worried, or we don't want to worry them about us. And that's understandable, and yet they're probably already aware of what you would be sharing with them. So I'd encourage you to be open about that. So pay attention to sleep changes, weight changes, challenges coping. If you notice you're pretty crabby and not just on a short-term frame, or you find that you're engaging in some behaviors that may not be the healthiest, like substance use. Symptoms like anxiety or depression, and that are disproportionate to the concern. Having a chronic illness in your life, of course, is going to provoke worry, and we don't mean to pathologize that. That's a normal thing to feel, but we don't want that provoking significant emotional distress for you more than it has to. So be aware when it would maybe be helpful to talk to someone about that. I put here several different resources. You all could probably add to this list for sure, but my group and the support group that I started for the transplant division taught me a lot about the online resources like Caring Bridge, and I looked up several others to help outline these for you. So the Rosalind Carter Center, by the way, has a lot of fascinating resources in terms of, like the dietitian was kind enough to put resources together for you where you can go to get good information. I found as I was researching to present to you all today that the Rosalind Carter Center had a lot of fantastic resources. I felt like it was a really effective summary. And of course, the Liver Foundation itself has good resources as well. So, and just one last quick addition here, the American Psychological Association also has, I think, a very helpful website for practical connections in terms of referrals, and also in independent coping enhancement like stress management tips. The IU Health team has a great team of folks who are prepared to help. And I'm glad to talk to anybody. I think it is a really normal experience to have some emotional turbulence when you are a caregiver or when you're the patient experiencing chronic illness. This changes your life, right? And yet it can change your life in not just challenging ways that I think people on the outset might expect that it would. There can be some fantastic silver linings to occur. The intimacy that it can bring you and your partner or your family member as you're caring for them or with them about what goes on in their life, that can be a fantastic experience. I have a lot of patients who've had challenges connecting with family members as a result of their chronic illness. A lot of times they feel people do not understand what they're going through. chronic pain in particular is a symptom that can be very divisive for people. It's something that you don't always see physical evidence of, or people can look the opposite of how they're feeling. And that can be really isolating. People do not always have a sense how you look on the outside is how you're feeling on the inside. And that can be very challenging because, the community in general can think, oh, you look great. They wouldn't presume that you're feeling necessarily the way you might be feeling. I also think, just as a last quick comment, that stigma around illness, particularly liver disease, is challenging and can be an issue for people wanting to get support. Cancer is a label that people, I think, in general in the community have had a sort of a learned response to. They know that they need to marshal resources of help. They'll often deliver on that help quickly, even if the help fades. But people don't know as well how to respond to other types of illness. And so it's more challenging, right, as a patient or the loved one of someone who's going through that kind of condition, to know how to help people know how to help you, and then how to accept that help, right? So I'd like to just open it up to conversation for what's relevant to you all, for questions, if Dr. Lambert wants to facilitate, or if people want to just raise their hands.
What we may do is, just to get everybody on mic, is have go with our
ahead and open
panel
up to the
discussion,
panel.
if that's
Great.
okay.
Okay, thank you so much.
Thank you, Dr. Montero.